Hello, and thank you for joining us. I'm Sandy Potter, along with Masonicare President and CEO, JP Venoit, and Dr. Ronald Schwartz, our Senior Director for Continuum Health Services. We're checking in with you once again as we all work together to help prevent the spread of coronavirus. Dr. Schwartz, this last week has brought several developments, including the first case of a new COVID variant found here in Connecticut and a possible fourth vaccine coming to the market soon in the US. Can you help fill us in on all the latest?
Sure, Sandy. And what you see every time we do these shows, there's something new going on. It's just constantly evolving, constantly developing, and we just try to stay on top of everything. So for the first point, Governor Lamont had a press conference about a week ago, and he did say that the first COVID P1 variant was found in Connecticut. I think it was Milford. And this actually was initially a strain that emerged in Brazil. So, what they found is that there were multiple mutations on the spike protein. And this really isn't surprising. We've talked about this in meetings before that, the COVID virus is an RNA virus. And RNA viruses mutate, just like the flu. It's just something that's going to happen. And I think the key is that, there's no real evidence at this point that this mutant is a lot more potent than the basic COVID-19 virus itself, but it is more easily transmissible. And that is significant because the more people that the virus is transmitted to, the more risk for illness, hospitalizations, and even death. So we definitely have to continue to be vigilant about everything. It's a new variant and it's still being studied, but the evidence that I've seen so far still shows that the vaccines that we have are still effective against this variant. But it's important to continue to remember, because variants will continue to emerge, to maintain the social distancing and the mask, wearing our masks, washing hands, avoiding large crowds, avoiding travel, and probably the most important thing I keep emphasizing, because I feel so strongly about it, is getting vaccinated. And that kind of segues into the next point that I would talk about, and this is sort of the good news, that it looks like on the horizon there is a fourth vaccine that's coming, or at least being evaluated for emergency use authorization, and this is through the Oxford Astrazeneca vaccine. So we've talked about this again in the past, and this is what we call a viral vector vaccine, similar to the Johnson & Johnson. It's made from a modified version of like a harmless adenovirus, and the ultimate product is the spike protein. And that's really what these vaccines do. They target, or they sort of manufacture a spike protein that we make antibodies to, whether it be a viral vector vaccine or an mRNA virus vaccine. So I'm just going to give you some facts that I know about this vaccine. It does appear to be of lower cost, and it can be stored, transported, and handled in a normal refrigerator type of environment for up to 6 months. So that's very good. And you may have read that some countries had temporarily suspended the use of the vaccine early in March because a small number of the recipients had some blood clots that developed. And there's an organization called EMA, European Medical Agency, and this is an agency that evaluates the effectiveness of vaccines, medicines, and so forth. And there's a quote here that said there was no indication that the vaccine actually caused these conditions. So both the World Health Organization and this EMA, European Medicine Agency, continue to endorse the vaccine. So I'll give you some facts that I found about this AstraZeneca vaccine, that it's actually a 2-dose vaccine. It's given like 4 and 12 weeks apart is when the second dose is given. And an early review of phase 3 trials, it's been shown to be 70% effective after the first dose, and 100%, actually 100% protection is what I've read, against severe disease, hospitalizations, and death, and that's really significant. So, the main thing we're trying to reduce and you know how devastating this virus was and how many people were hospitalized on ventilators and so forth. If you can have that high a number in reducing death, I mean, it's a great thing to have in our armamentarium. And actually, we talked about asymptomatic carriers last week, and actually it's been shown to reduce asymptomatic transmission as much as 67%. So there's a lot of good things about this vaccine. And again, the fact that they're looking at the data so carefully shows you that before anything is approved, it's safe. So I think what we have to continue to remember is that each day, every time we talk, we're making more and more progress. We're getting further along in our fight against this pandemic, but we still have to remember to be diligent. And again, I just reinforce this because it's so important to wear the masks, wash our hands, and socially distance, and avoiding large crowds, and trying to avoid travel for now, and again, get vaccinated. So here comes my quote for the week. And this says, if you're going through hell, keep going. You know who said that? It was Winston Churchill. So many of us feel like we're going through hell, it just keeps on, it doesn't stop. You hear something else in the news, like we're talking about with new variants and so forth. But again, the positive thing is we'll probably have another vaccine soon. These vaccines are effective, and we just have to continue to be diligent in the meantime. And so once again, I thank everybody for their diligence, their hard work, just sticking to things, and I wish you health and peace. Thank you.
Thank you so much, Dr. Schwartz. I think we all could use that quote. Thank you very much. And JP, in great news, our Masonicare communities continue a very, very slow reopening plan. How is that process going so far?
Well, Sandy, our process of slowly opening is actually doing very well. In our nursing home, we have started visitations again, in-person visitations in our building. And I will tell you, they are going extremely well. With that being said, though, we are going very slow. And for a whole host of different reasons, many of the things Dr. Schwartz talked about with regards to still staying vigilant is extremely important. And as an organization, the last thing we want to have happen is for the spread to come back in any way, shape, or form. And we've done very well, but it's still out there. As an example, one of our staff members here at Masonicare's family member came down with COVID just recently and had to spend some time in the hospital. And I can't tell you how stressful we saw this employee going through really a very difficult time. And it only tells us that that's what our family members are going through. That's what a lot of people are going through. And we can't forget that. And that stress and that isolation of not being able to see their loved ones is probably one of the hardest things I think we're all dealing with. We are very close. The vaccines, as Dr. Schwartz talked about, we've got another one coming through. It really is helping us fight this battle. However, we can't go too fast because if we go too fast, we may actually regress, and that's what we don't want to see. And the vaccinations, yes, they're fantastic. They're going in so many arms here in Connecticut that we are getting very close, very, very close. But we still need to be very vigilant. And when we think about our opening, our residential services, we are slowly opening up. We're seeing a lot of visitors on the campus. We are opening up our dining rooms in our residential services side. We're starting activities. So there's things that are happening, but in small groups, very restrictive still. And that's really to keep everybody safe. It still comes back to wearing your mask, avoiding large groups, socially distancing are all things that we still are telling all of our staff and our residents to continue to do. That will help in getting us into what I'm hoping is this summer to really have some true normalcy. And that's really what I'd like to see happen. But we all have to do this together. We all have to still continue to be vigilant during this time, letting our guard down, even with the vaccinations. Even if you have been vaccinated, don't let your guard down. Still continue to do everything you can to avoid the spread of this terrible virus. And I'm happy to say our staff are doing fantastic in combating this virus, and our residents that are in our communities understand. They are just as concerned about making sure we don't open up too quickly to spread the virus. So there's a lot of optimism out there, but there's also a lot of cautiousness in making sure that we are ahead of this and it does not come back in any way. So I think everybody continue to stay safe. Dr. Schwartz, your quote is dead on when we think about our organization. We started our task force 381 days ago, had our first case in our independent living and a patient in our home care company 360 days ago. So next week, when we talk, we will actually be over a year since our first case. So that hell started. But I still have to tell you, looking from hell up, the sun was always shining because we knew we would conquer this and get ourselves back to the normalcy. So thank you everyone for watching, and thank you everyone for supporting Masonicare in whatever way, shape, or form you have. And again, stay safe and stay well.
Wonderful, JP. Thank you so much. And thanks to both of you, as always, for your time and sharing all of this important information with us. And of course, we thank you for joining us at home. Until we see you next time, we hope you stay safe and stay well.